my channel.
Oh, you just sound better.
I want to make YouTube videos.
I sound like one YouTuber.
Hey guys, what's up and welcome back to my channel. I'm back again today with my beautiful friends right here, Dr. Fatima and Dr. Farida. Say hi guys.
Hi.
So guys, today we're going to be talking about diabetes mellitus. It's the month of November and it's the month to create awareness for diabetes mellitus. So we're just going to be talking to you guys about diabetes, what it is, the types of diabetes mellitus, the risk factors of diabetes mellitus, the symptoms and signs and the complications, diagnosis and management, just the basic things that you need to know. Try as much as possible to touch like the most important parts of it. So yeah, I hope you guys are going to enjoy this video. Don't forget to hit the subscribe button, you know what I'm saying, and sit tight and let's get right into the video. We're going to start up with what diabetes mellitus is. Now, so we're going to start with what diabetes mellitus is. So diabetes mellitus is a metabolic disorder where the body is unable to use the sugar from foods that we eat, carbohydrates like yam, gari, rice, cassava, and every other food out there that contains sugar. So it's just when the body is unable to use this sugar properly and in the right way. Having known what diabetes mellitus is, I'll just take us through a bit of a rundown as to how the body is supposed to, dissipate this sugar that we ingest in. So we have something called the pancreas, right? And the pancreas produces insulin. Now this insulin is supposed to act on the sugar when you eat and, enable it to be dissipated accordingly in equal proportions to every part of your body. It also stores this sugar as well, and then we also get energy from the sugar that it stores. Now when the body is unable to use the sugar, it means there's something wrong with the insulin that is being produced. Either it's not being produced or it's not being produced adequately. So that's where we go into the types of diabetes mellitus. We have the type 1 and we have the type 2. So in type 1 diabetes mellitus, right, it is an autoimmune disease. So that means there's really no known cause of it. It just happens. So the body attacks itself by mistake. In so doing, it affects the pancreas, which produces insulin. The cells inside the pancreas that produces insulin is called the beta cells. So your body attacks these beta cells, destroys them, and so they can't produce this insulin enough for it to, dissipate the sugar accordingly. So type 1 diabetes mellitus is also known as insulin dependent diabetes because insulin is not being produced, so you wholly have to depend on insulin for your survival. Whereas in type 2 diabetes, there's a resistance to this insulin that is being produced. So the parts of the body that require insulin isn't accepting this insulin that is being produced. It's like going to knock on the door and the door isn't being opened to you. So when that happens, because the liver, the fatty tissues that are supposed to accept this insulin do not, the body keeps producing so much more, and then in the long run you could also become insulin dependent, because it's like putting in work and then you're not seeing any result, like, so you keep wanting to like put in more work. So that's just basically what type 1 and 2 is. So now we're going to be talking about the risk factors. I don't know if we should share it like type 1 risk factors, or we just talk about everything.
Yeah, let's do
type 1 and type 2. Okay, so the type 1 risk factors. So risk factors like we talked about in the last video. If you haven't seen the last video, we talked about breast cancer. Please do go check it out. I'm going to leave a link to it down below. So risk factors, basically things that predispose you to this disorder. So the type 1 risk factors: age, family history. I feel like family history is risk factor for almost every illness, because someone in your family has it, the chances of you having it is also increased. Age, family history, geographical locations, what else again? Genetic factors as well.
To some viruses.
Yeah.
The exposure to some viruses depends on your genetic predisposition. Now, if you have the genes for type 1 already and then you're exposed to some kind of viruses, it could trigger the onset of diabetes. So
there are 2 peak age ranges when you could see that this person might actually have type 1 diabetes mellitus. It starts from children between 4 to 7 years and 10 to 14 years, right? So you might notice it at these 2 points in time. So then you have to be aware.
This is not to say that it cannot affect like
older
ages,
people as well,
like
but
this
like
is where it's most likely.
and the genetic and the geographical is basically they work hand in hand together. So if you have the genetic factor, then your environmental factors can also like affect you and cause the onset of the onset of
the illness.
So I think basically what we're saying is that with type 1 there has to be a predisposition, right?
Yeah.
For you. Even with type 2, but like with type 1 it's stronger because it's like the main thing, being genetically predisposed to having this disorder.
Then the type 2 risk factors.
Yeah, risk factors for type 2 diabetes mellitus.
Yeah, we have obesity, we have sedentary lifestyle, so people who don't do exercises frequently, poor diet. If your diet is like rich in sugary food, like you take not balanced diet, basically
unbalanced diet.
They also have family history of type 2 diabetes. So if someone in your family has a history of type 2, I think first line, right? If they have diabetes, the chances of you having diabetes are like higher than somebody whose family member does not have diabetes. Then apart from that, what else we have?
Dyslipidemia. That's like if you have another disorder with fat metabolism, and then if you have hypertension also, you have a risk for diabetes. Like that's the thing.
Diabetes that's predisposed
to
so basically diabetes and hypertension are like
illnesses.
They're like sisters.
They like following each other literally with chronic illnesses.
Yeah.
That's why the whole lifestyle thing is important to actually talk about.
Going to the causes of diabetes mellitus, we've already differentiated them. We have type 1, we have type 2. In type 1, like we already said earlier, it's autoimmune. So we can't really say what the cause is. The body just attacks itself by mistake. However, in type 2, there are certain causes that we could actually look to and say, okay, this is what, caused this. Sorry, darling.
Sorry.
We didn't need to.
Sorry.
Yeah. So, like in type 2, the thing is that even though there's a genetic component, but your lifestyle choices do matter a lot. For example, like smoking,
I'm so
sorry.
It's okay. She has an allergy. Sorry.
Oh my god.
So your lifestyle choices matter a lot. Smoking, living a sedentary lifestyle, no exercise, no physical activity, being hypertensive, and especially poorly controlled hypertension. All these things can also lead to
So that's being hypertensive, and you probably don't know about it.
Yes.
Or you're probably not taking, or you're not taking your medication, you're not taking your blood pressure checking, which is another thing. Like take your BP check very seriously, because do people pay to walk into a hospital to get their BP check?
I don't think so. Even though, but there are like so many people nowadays that do these things just.
Yeah,
like there's so many.
Anywhere you see, like maybe medicals gathering, and
yes,
they have outreaches, and you can just, if you can't buy a fig, like just go get it.
Even if you have to walk into a hospital, I don't think it's.
I never saw anybody in National Hospital that came to check
Yeah,
would you even wear if you were on call and you're having a very hectic call, and someone walks up to you and say, "I just came to check my."
This person's serious. What's your problem?
I'll be like, okay, that's nice.
She's nice. She's nice.
No,
I could.
I'll probably look at you like.
But even if I'm not like, okay, come back to GOPD or something like that.
Oh yeah.
But
I wake me up from sleep to check your BP.
Okay, no, no.
Exactly. So so those are the causes basically. So now we're going to be talking about the signs and symptoms of diabetes mellitus. So what are the signs and symptoms of diabetes mellitus?
Okay, so you can see increased thirst, frequent urination, waking up to urinate at night, and in children this can like present as bedwetting, especially if it's a child that does not bedwet normally and they start bedwetting. So you can think of that.
And I feel like in this part of the world, in Africa, if the child just suddenly starts bedwetting, the mother will be thinking like there could be an underlying illness. So like you should not just beat the child, just take it serious as well.
Yeah, we should not be quick to like dismiss these things.
There's also weight loss, which could present the increased thirst, increased urination, increased appetite, and weight loss. Those are like the main symptoms of
and frequent urination at night as well.
So in addition to that, you could also like some weakness, maybe like having recurrent urinary tract infections, all these things. Some people even present with blurred vision,
headaches, fatigue,
Yes.
and then some people present with like they notice that their wounds don't heal fast.
yes,
Yeah,
yes,
true.
yes.
Yeah,
So
true.
wounds don't heal fast. So yeah, there are a bunch of like non-specific symptoms, which is why you have to be, you know, on top of your game in the beginning with your lifestyle, with your regular checkups and all that. So these things do not catch you unawares.
But I feel like it's advisable for us to in this case of this BP thing, please, if you can, buy a Swig and have it
Yeah,
outside.
there's the automatic one. You
Yeah,
don't even
sure, you don't need anyone to check it for you.
Or your
Just
smartwatch even.
Yeah.
True, yes.
Smartwatch
Yes,
even.
true.
Just, you know, to help yourself and be on top of your game.
Yeah.
So we've talked about, you know, diabetes mellitus, what it is, the risk factors, the causes, signs and symptoms. We're just going to take you through the diagnosis. So from before someone is diagnosed with it to after someone is diagnosed with it, or to the point where you get diagnosed with it, things you should, just the basic things you should know, what you should know. There's some blood tests that, you know, would help you sort of like an indicator to show that, okay, you're prone to this, or you might soon be diabetic. So that's just what we're going to talk about now.
Yeah, and the ranges are especially important. I'll talk about them like in a bit, but they're important, like especially if you're diabetic. Like you can't tell me that you don't know when your sugar is high. You can't tell me you don't know when you're hypoglycemic, because they're like, you know, the glucometers. You should check yourself at home, so you should know your range. Is very important. So we have the pre-diabetic range. So the pre-diabetic window is a place where, okay, there's the normal blood sugar level and there's a range that you're diabetic. So you're somewhere in the middle of that. So if the disease progresses, now then you become diabetic. But if you're lucky and you find out at that stage and you take some measures, you could actually go back to having a normal blood sugar range. So we have the fasting blood sugar, we have the random blood sugar, and the HbA1c. The HbA1c is a test that shows you your blood sugar control for like 3 months prior to when you take that test. So for the fasting blood sugar, this is done like after 8 hours of not eating. So there's a range of greater than 7 millimole, that's diabetic. Then from 5.6 to 6.9, that's in the pre-diabetic range, and 5.5 is considered normal. Then for the random blood sugar, greater than 11.1 is diabetic. Then from 7.8 to 11, that's the pre-diabetic range, and less than 7.8 is normal. And then the HbA1c, greater than 6.5 is diabetic. Then from 5.7 to 6.4 is the pre-diabetic range. So those are just the diagnostic ranges that we use. Or like if you're doing a random blood sugar, you'll have to have at least like two tests before you.
Yeah, but you know, funny enough, like now we're here saying, oh, this is sugar level, this is so many people out there do not even know how to go about this.
True.
And then I feel like these things are not brought easy, are not, you know, really made available easy to people, because there's some, I want to go and tell somebody that has not eaten somewhere in Masaka or Maraba that's do you know your sugar level? It's crazy, but like try to reach out to people, like you who's watching this, like engage those people, and they should know how important it is.
But then, you know, the thing is that the person in Masaka or whatever even needs to know about this more, because should that person actually become diabetic?
But how would the person know though?
Exactly. So, you know, this is why we're doing things like this, and like this is why all this the whole outreach, everything, things like this are important. Because this person that you're talking about will probably not come to the hospital till when they have complications. You know?
The person will never see this video probably. So,
Exactly. Exactly. That's my point.
So this is why everyone should raise awareness at whatever level. Like let's have this.
Yeah, just talk about it. You can gist about it. I mean, when the person doesn't understand English, speak whatever language the person understands, and you know, help the person to understand this. So we've talked about the diagnosis. Now we need to talk about we're going to be talking about the management of, you know, diabetes. So if you've now passed that pre-diabetic stage and you now require treatment, so
for the management, we have different ways to manage diabetes. We have the non-medical ones and the medical treatment. Now the non-medical treatment are like lifestyle modifications that you could do to help reduce your sugar level. And we have like if you're obese, you could lose weight, try to lose weight. try to eat more balanced diet, reduce the fat, because there are some kind of fats that are actually very dangerous. There's some that they say that they are not as dangerous, but like there's some that
there is something called wicked fat.
No, it's actually wickedness because it's predisposing you to diabetes and all sorts of this thing. So try to eat balanced diet basically. Try to avoid smoking, reduce alcohol intake. What else? If you're not really active like physically, try to engage in more exercises. Even if you can't go to the gym, you can take a walk around where you live, jog, skip, do whatever. Just try to be active.
Even just walking, like
just taking along.
The medical treatment, well, it depends on the type of diabetes. Now, if it's type 1 or type 2, that will determine the kind of treatment your doctor will prescribe for you. Now, the type 1, they don't produce insulin. So they'll definitely be dependent on insulin. So those ones,
the type of insulin is left for your doctor to determine.
There are different types of insulin. Then for the type 2, there are some drugs that could help your cells. As she said earlier, that the insulin will knock and the organs won't open for the insulin to do its work. So there's some kind of drugs that help those organs recognize that this is insulin, open the door. So they'll prescribe those kind of drugs. There are different classifications of the drugs, but we're not going to go into them. Then
we're not doing online treatment.
Then as the disease progresses, some people in type 2 might actually require insulin, as she had explained earlier, that with time the insulin production will be reduced and all that, so they might require insulin. But the first line of treatment for type 2 is usually the medication. But the main thing is that apart from drugs, you can't just rely on medical treatment. You need to
make your lifestyle changes.
I feel like almost every illness just requires lifestyle.
Well,
actually, really, everything. Even like you have to, especially like she mentioned insulin, right? But this is like for type 2, this is like at an advanced stage. So the goal is to not even allow it to get there, You've been told you're diabetic, okay, maybe you have to get on medications. So sometimes you can even start with one medication, then it moves to 2, it moves to 3, and like you don't want all that. So that's why the lifestyle thing is as important as, more important than that medication. It's not like, it's not like malaria that you go and they give you the medication and you take it and
it's for life. That's something else.
So because it is for life, then your lifestyle changes too have to come in. So you can help your body, it's more important than the medication. Like the medication should be supportive, but you should change your outlook, change your diet, exercise, try to live well, make conscious choices.
So that's basically it for the diagnosis and management of diabetes mellitus. However, it could advance, like we stated, it could advance and it could cause some complications. If you see people with this type of things and you're wondering, but what they do? It could just be a complication of diabetes that wasn't, left unchecked. So complications of diabetes mellitus: stroke, sudden stroke,
affect all
heart
parts
attack,
of the body,
all like the whole body, everywhere, eyes, kidneys, the eyes. Everything could just, go wrong.
I do not like seeing diabetic
foot ulcers could lead to amputation.
I think let's even talk about diabetic foot care. Because, please, so if you have diabetes, you make sure that you do not take your bath with either too hot or too cold water. It should just be warm. And then you make sure to moisturize your feet, but not in between your toes, because that will create moisture and
make it wet.
And all that. So you make sure that you also wear shoes even inside your house, not just when you're going outside. Yes, they should not be too tight. And then what else? You try to make sure that your legs are not dry. And you wear shoes outside, you avoid injuries.
You avoid injuries at all costs.
And inspect your feet.
That's what I said first. Inspect. Because you could get a wound as a diabetic person, and maybe you probably have the diabetes has already affected your nerves, so you wouldn't even feel the pain there, and then the wound will keep getting infected, increasing, and by the time you notice, you'll probably be like too
Too
late,
late.
And your
or
wounds
advanced.
do not heal
They don't
easily.
heal easily.
They do not heal
So it's just
easily. if
prevention
you're
is better
diabetic.
than cure.
Yeah. So you can just take a mirror, make it a habit. You wake up in the morning, just use a mirror to look under, in between your toes, just to make sure everything is fine. Yes. Diabetic foot.
It's a nightmare.
Yeah, and then they have some diabetic emergencies.
Yeah.
That could occur maybe due to poor sugar control,
Yeah.
or like in some cases, like in the case of type 1, they might not even know that the child was diabetic, and then
Yeah,
the first
they just
presentation
come
would be like
with
coma.
Ketoacidosis.
Yeah, so we have those diabetic emergencies like diabetic ketoacidosis, the hyperosmolar, hyperglycemic state, and hypoglycemic crisis. Now, the thing with diabetes is that they're saying your sugar will be high and all of that. It doesn't mean you won't eat, like you will go and start fasting, because that will also affect you and then lead to another crisis. So everything's about balance.
Yeah.
Just have to balance everything out.
And hypoglycemia is also as you can also go into coma. It's a whole thing on its own that is terrible. So you do not starve, okay? You're diabetic, yes, so you take your medications and you take regular meals. And then so like, how do you know when your blood sugar starts getting low? You can start shaking, sweating, feeling dizzy, confusion, or even irritable, you know. So then at that time, if you can check, you check. If you can't, then you quickly take something to try and lift up your sugar.
There's something like Coke.
Yeah, you can take Coke, but not like a whole bottle of Coke. It's just like half a cup to help your sugar.
That's in the case of hypoglycemia.
Yes, if you have hypoglycemia.
If you're already diabetic, and then you start feeling these symptoms like that we listed, confusion, dizzy, you just can't think straight, then you know that you might be having hyperglycemia. So that's when you drink a bit of Coke, not the whole thing.
Exactly.
So what else do you talk about?
Okay, so awareness campaign, right? So we have to tell you how to prevent how to reduce your risk. How to reduce your risk.
Reducing your risk of diabetes mellitus.
Exactly. So let's say, for example, you're a young person and then your mother or your father is diabetic, and you know that this is a genetic disease, and you're worried now, does that mean that you're also going to be diabetic? What can you do about it? So what you can do about it is that you start making those choices, those lifestyle changes that we said from now, you make sure that you're not overweight, you're just normal, you eat well, you eat balanced diets, when you take your plates, you divide it, your vegetables should be like half the plate, and this goes for like those.
By the way, guys, you should follow her page on Instagram, Eat and Flourish. I'm going to leave you in the link in the description bar below. It's basically going to tell you how you should be eating right.
All of that. Thank you. So like your vegetables should like half the plate, and then the other half you can divide it into two again, and then your carbs and then your protein on the other side. So what else? You exercise, right?
Yeah, exercise, right. And then for people who already have that family history, I feel like it's important for you to buy a glucometer. It's expensive, but I think it's important. I feel like everybody, in fact every house should have a BP monitor, a glucometer, because you never know. There was one day I checked my sugar level 2.3. What? I was like, what? It was doing house job. I had been on call. Yes. I was like, what? Good. That's why I just did. So we don't enter like a crisis, and we didn't.
So that's basically, even if you can't afford a glucometer, try to do like checkups maybe twice a year or something. They'll do like check your sugar, check everything, just make sure everything is doing okay.
Then our hospitals should be trying. I feel like hospitals should be a place where people can just come in, not pay
at least for those basic things.
Seriously. I feel that's what outpatient department should be doing.
Honestly.
You don't have to pay through your nose to, at least know the basic, know how your health is doing.
That pre-diabetic window too, I feel like we should say something about that. That stage between, you have impaired. I feel like a lot of people feel like, that's it. If it's impaired, then you're just going to move to the other side and become diabetic. But
no. Of course, that's window period.
You should
pre-diabetic window period when your sugar level is from 5.4 or 5.5 to 6.9. If you're in that window, you should take precaution as well. Don't just you never enter diabetes, so
let me just relax.
Yeah, you should take. That's when you should even be more.
Take it really
Yeah,
serious. Just lifestyle
because,
modifications.
You're very close. There's a thin line between love and hate. It's that kind of relationship that's going on
because,
there.
Once you're diabetic, you're diabetic. But if you're pre-diabetic, you can move back to the good side, so to speak.
Yeah.
So
yeah. So that's it. This you done.
That's basically it.
So that's all.
So
So yeah.
Sorry.
Sorry. So yeah, guys. I hope you learned something from today's video. I hope you enjoyed the video as well, and we're looking forward to doing more videos. We're going to be doing like a med series actually on this channel. So this is going to be med series video 2.
Yes.
So make sure you subscribe and hit the bell icon to stay on top of your game and be updated for more med series videos from us.
I'm so
So
sorry.
yeah, thank you so much for watching this video. I'll see you guys in my next video. Do take care. And by the way, guys, if you have any suggestions or any health challenge or health topic you'd want to know about, make sure you leave it in the comment section below. And yeah, we'll see you guys the next time we're here together again. Do take care.